we cannot prescribe medicine, and
Okay.
any clinical psychologist or any psychologist is prescribing medicine, run for the hill.
What are your top three recommendations
Mhm.
to always work for your client?
Actually understand what is going on with you.
I mentioned like coping mechanism. I think that's 200% absent in all the mothers' life because they will do everything for everybody, but they will never have time for them, come for one session, and then they disappear. What are the three top things that you recommend over and above medicines? Like this prescription is there, but are you also following certain set of activities? What is those certain three set of activities that you usually recommend to your client?
Yeah, for being a clinical psychologist, it's just for the viewers that we cannot prescribe medicine. And
Okay.
any clinical psychologist or any psychologist is prescribing medicine. So the
Is
first thing you need
wrong,
to do
wrong.
is run for the hill. Definitely, that's the wrong number. In what was that PQ Amir Khan's movie? The wrong number, I guess.
TK.
Yeah, PQ, it was a wrong number. है.
Yeah.
So wrong number. है. So psychologists
The
or clinical,
clinical psychologist
yeah,
for the viewers cannot prescribe you
yeah,
medicines,
yeah, can never
but
do that.
there are some things,
Yeah.
some prescriptions, like
Mm.
not medicine, but still prescribe certain things like journaling or meditation or
Mm.
some things. What are your top three recommendations
Mhm.
to always work for your clients?
Yeah. First thing that I will always like, this is my preset that whenever a client comes to me in first and second session, I obviously give them these things. First thing is coping mechanism. Having a coping mechanism, establishing a coping mechanism. It can be grounding, it can be distraction, and it can be a lot of different things. That is the first thing. It can be obviously breathing, yoga, meditation, journaling, art, play. There are like endless list of coping mechanisms that we can do. That is
Amazing.
the first. Second thing is to understand what is going with you.
Hmm.
Right? Because once the first thing is to actually manage the body symptoms, whatever your body is going through, and that will be obviously managed by the coping mechanisms. And only then you will be able to understand and process what is going on in your mind. So the first is to learn to cope. Second is to actually understand what is going on with you. And is it really happening? Or
Absolutely.
someone is telling you that this is happening. A lot of people come to me is like, I have this or that. It's like, are you sure that you have this or someone told you you have this? The
Or
majority of the time,
you read it from the Google.
exactly.
Yeah.
Exactly. It's like, okay, I have read the DSM. DSM is actually a diagnostic criteria, and ICD-10 well, it's a diagnostic criteria.
DSM
It was like,
5.
I
Yeah.
know that.
Yeah.
Yeah. And
DSM
that's
5,
why,
they must be coming like I read it in DSM.
yeah, I know I've read your case history, I've read your form and everything. I just want to know it from you in your own language, in your own words. What are you going through? And 95% of the time, or 90% of the time, obviously, the story drives the other way. So the first thing is coping mechanism. The second thing is to actually understand what is going on with you,
Absolutely.
right? Originally, what is going on with you, to understand and creating it a lifestyle,
Yes.
not only when you need it, or not only when you are ill or going through a tough time, but creating a lifestyle. Third thing is to actually understand what is causing it. Either it's a trigger, it's a stress, it's a burnout in workplace mindset, or it's a familial issue, it's cultural issue, or it's media consumption, anything that is triggering it. And then obviously you can go for solution. And one of the most important thing that I am doing, and I always prescribe to my friends, students, my team back at the hospital, is to make it a lifestyle. Integrate it in your life, like religiously practice it each and every day. Yes, you can have one cheat day in a week. I allow one cheat day in a week. I usually take two cheat days in a week. So
Uh-huh.
I actually take 2 days, two cheat days, but from Monday to Friday, I
Not
practice it each and every day. So my formula is to have at least like half an hour at the end of the day and doing these things, doing something for your mental health, for your well-being, and regardless of how busy I am, regardless of how busy my schedule is, I always do this. First thing is coping for body symptoms, to manage your body symptoms, anxiety, panic, stress, and those things. Second thing is to understand what is really happening. You have to actually identify. The third is what is causing it. And then obviously you can go for the solution. We have clinical psychologists, general psychologists, counselors, coach, and obviously we have educational, industrial, organizational. These are certain branches, but we have a lot of profession. You have to reach out. Things won't gonna fix itself.
Yeah,
Time will help them evolve, not fix. And we never know what a
yeah,
person is moving.
absolutely fantastic. So, Mubarak, I've understood like even for mothers, if we talk about
Mm.
all three things, like is applicable, you know.
Yeah,
Number one
exactly.
is, yeah, number one is you have mentioned like coping mechanism. I think that's 200% absent in all the mother's life because they will do everything for everybody, but they will never have time for them to do some art, to listen to some good music, or to do basic
Mm,
self care or something. And forget about understanding the causes and then
mm,
understanding other stuff, that's secondary, but the primary is like you have to do the first step, which is coping mechanism, doing
yeah.
something for your well-being for 30 minutes. You are in 24 hours, you do not even give, like they always do chain thinking, they always into a lot of thoughts, but then
Mm,
never do something to for the mental health. So that's
mm,
very, very important. We have, I think we have talked a lot around mental well-being and how we can cope up at for the women workforce at workplaces, and we have talking about the
mm,
childhood traumas, and we have also talked about like a lot of information coming from all the, like it's flooding in, and then you should be able to judge it if you're,
mhm,
are you on the right path or just doing it for the heck of doing. One more
mm,
question, Mubarak. I see very inconsistency when people start their care therapies in that, and then they suddenly stop,
mm.
come for one session, and then they disappear. You know,
Yeah.
they say, no, I have started talking to my sister, or I started talking to my mother,
Mm,
and I've started writing. It is helping me a lot. Do you, as a clinical psychology, I'm sure you must be experiencing this.
mhm,
What is your idea around it? Does it really work? Can you come out of this yourself, or you really need to
mm.
continue it for a certain period of time and then stop it?
Well, in this question, I always ask my clients or patient that there's something that took years to develop or years to reach at this stage. You need to figure out how long it'll take. If you think that it can just resolve in one session or two sessions, good luck with it. But this is not happening. Something that happened over 1 year, 2 year, 3 year, 4 year, 5 year will take at least this number of
Yeah,
sessions. So
absolutely.
what happens is that that's why I always reinforce that make it a lifestyle, right? Why? Because sometimes I think working and psychologist gave something that is working, and we feel like, okay, we're now all good, everything is settled, everything is sorted, and now obviously I can. There's this, I believe, meme of fame that phrase that ice cream is better than therapy. Something, yeah,
Yeah.
I don't exactly remember something like that, but it's like ice cream will melt, but therapy won't gonna melt on you.
Okay.
So we have these misconceptions, and obviously, media influences are very damaging in terms of therapy. That there was, I just gonna add this, that there was this interview of Ranbir, I believe, in
Yes.
last month, or
Yes.
last few months, when he shared his own journey, that
Yes.
therapy didn't work for him, and actually people took it as that therapy is useless, and it was actually reinforced as Ranbir is saying that therapy is useless. He didn't say that therapy is useless. He said that it didn't work for him.
Hmm.
Probably it wasn't the right. But there are a lot of different therapy. For suppose medicine, there are different medicine for different kind of pain. Similarly, in therapy, they have different therapies for different type of presenting complaints or illnesses. So it's really important to continue it, because if you're going to stop the process, you're going to go into the vicious cycle, and
Circles.
you're always going to
Yes.
live on that.
Absolutely. I think all the children, like you have mentioned Ranbir in specific. So he
Hmm.
mentioned like I used to cry hours sitting on the stairs,
Hmm.
because my parents were always fighting. And
Hmm.
now when I'm married, to Alia Bhatt, and when she
Mm,
raises her voice, it pricks me and triggers me. I think that
exactly.
becomes the trigger point because you have that's a childhood trauma that you're carrying, and now
It's stored in the body.
yeah, it goes into the minutest of, I think, minutest of the
Mm,
cell. Like it gets into your emotional
mm,
memory, and it
yeah.
takes time for you to take it out from your subconscious mind and getting conscious about and accepting things when other people are behaving in certain ways. Because if you'll not accept, then you'll start not only harming your own mental well-being, but the well-being of the other person also who's
Mm,
living with you or is dealing with you or is then you both will suffer. So this is for the viewers. If something did not
mm.
work for somebody, it doesn't mean that it will not work for you too. Hello, parents. If you find our podcast relatable, educational, then do subscribe to our channel. In the comment box, write your parenting challenges. We'll try to address them one by one. And never forget to share it with amazing parents like you. Because remember, by learning together, we can raise kind, confident, and connected children for happy families and happy nations.